Good morning, students. Today we are going to learn about school health service. So before we will start this topic, let's just understand what does it mean by. Now the name itself, it is saying school health service. That means the healthcare service, it will be provided to the school children, right? So let's just start with the introduction. Now, the introduction, it is saying that it is an important aspects of community health nursing. It is possible to increase the health of community and achieve growth in the health of future generation through school health service. Now, it is a important aspect of community nursing, right? And the health of the community and the health of the future generation, it can be achieved through the school health service. Okay. Next will be your definition, and now just let's learn what does this definition it is saying. Okay, now the definition of school health service is the school health service refers to need based comprehensive service rendered to pupils, teachers and other personnel in the school to promote, protect their health and prevent and control disease and maintain their health. Okay, so now as I told you the meaning of school health service, right? So let's just understand what does this definition it is saying. That means the school health service means it is the comprehensive service to the peoples and to the teachers and to the school workers in order to promote their health and to protect their health from the disease and to prevent them from the disease and control their disease to maintain their health. Okay, so the school health service means it is the service provided to the school children as well as the school personally in order to promote their health and protect their health and prevent them from the disease and control their disease and to maintain their health. Okay, next is your aim. What is the aim of this school health service? So the ultimate aim of school health service is to promote, protect and maintain health of school children and reduce the morbidity and mortality rate among them. So the aim will be yours to promote their health and to protect them from the disease as well as to maintain their health and to reduce the morbidity, means that is their death rate, and morbidity means the disease rate and the mortality rate means the death rate among them, right? Next is your objectives of school health service. So the first objective is to promotion of positive health. That means we need to promote a healthy lifestyle among them, right? And as well as to prevent them from the disease, and we need to early diagnose that particular disease as well as to treat them and as well as to teach them the follow up care, and as well as to provide them a healthful environment, okay, so that they can achieve a good health, right? Next next is your principles of school health service. So the first principle is it is based on the school health needs of the school children. That means what kind of health care that school children they need. Suppose that school children they are suffering from a particular disease. Suppose take an example of malaria. So our care should be based upon their health needs, what kind of care they need. Okay, depending upon their health issues we need to provide them health care. Okay, and it should be planned in coordination with the school personally. That means we need to coordinate with the school workers or school team members, that is your that school principal, teachers, along with them we need to plan the healthcare as well as to we need to provide care along with them, right? Next, it emphasizes on health education to promote, protect, improve and maintain health of children and staff. Now the health education, it is very important, right, in community health nursing, right. Here also you need to give health education, and the health education, it should be based on their disease condition, so as to they can promote their health, and they should learn how to protect themselves from that disease, and it should be based on the improvement of a healthy lifestyle, right. Next is your, it emphasizes on learning through active participations. Okay, so they can learn, right, they can learn a healthy lifestyle through their active participation. That means we need to show some demonstrations also, and we need to encourage them to do these things, so that they will not be sick, right. That means that school personally also they need to participate with you, so that they can adapt a good healthy lifestyle, right. And record keeping and reporting also, it is a very important thing in community health nursing. Whatever procedures we are doing, and what all the things we are teaching them after all the services, we need to record the services as well as to report the services, right. Next is your components of school health service. Now the objectives are health appraisal of school children. That means we should do a periodical physical examination to the school children as well as the working members there, so that easily we can find out if they are suffering from a particular disease. Through this routine examination we can find out, as well as we can treat them, right. Next is your prevention of communicable diseases. How to prevent this communicable diseases? Through immunization or vaccinations, right. Next is provide a healthful school environment. That means the environment also, it affects on physical health, right. We need to teach them what is the importance of environment hygiene, right. Next is the nutritional service. That means we need to give health education on nutritional diet or balanced diet, right, so that they can eat a good diet, or they will include that good diet with them, right. Next is first aid emergency care. Now it is very important, the first aid services, it, the school must have this service, right. So during the time of that school, if some children they are sick, or they are getting injured, the this first aid, through this first aid they should take care that children before transferring to the hospitals, right. Now next is your mental health. Now this school children, they are more prone uh, to drug addiction and maladjustment and juvenile delinquency. Now it is increasing day by day in between the school children, right. So to avoid these mental issues, the school team members, they should engage that school children in some curricular activities, right. And as well as they should guide them, that children, as well as to counsel them, right. Next is the dental health. Now the dental caries and tooth decay, these all the things are more you can see in school children, right. So we need to educate them about the dental hygiene. We need to show them the demonstration to how to brush their teeth, so that they can prevent the dental health issues among them. Next is your health education. Now the health education, it is very important. In health education, it should include how they can adapt a good healthy lifestyle, right? How they can promote their health, how they can prevent their disease, right? These all the things we need to include during the time of health education classes. Okay, next is your school health team members. These are the members who will be giving the healthcare service to the school children, as well as they have to participate during the time of during the time of healthcare service. So the school health team members are that school principals, school teachers, community and medical officers, and community health nurses. So the last is your role of a nurse. Now the role of a nurse in school health service are health educator, advisor, organizer, leader and evaluator. Now the nurse has to give health education to the school people so that they can adapt a good healthy lifestyle, as well as she has to advise them what is the importance of to keep themselves healthy, right? And as well as she has to organize all the nutritional program and healthcare program inside the school. She has to play a role of a leader during the time of that school health service, and she has to evaluate her care in the end of the service, how much it is effective, whether it is effective or not, as well as to the nurse has to give record of all the services which she has given in that school, right? So this was all about the school health service. Thank you.